Welcome to the Doctor's Mentor Show. If you believe that medicine is an industry and not a profession, if you enjoy submitting complex reimbursement claims, or you would do another residency just for fun, be advised, you're about to be offended. You should probably leave now.
All this talk about mentoring doctors is ridiculous. I thought doctors learned to do everything better than everyone else the first year of medical school. At least that's the way they act.
If you love assisting patients with vitality breakthroughs, if the right to practice medicine without interference is important, and you want expert tips for practice freedom and profits to support your epic life, welcome aboard and prepare to be blown away. The Doctor's Mentor Show starts now. Here's your host, Dr. Lori Barr.
Today's episode falls under the category of
Live.
Today's topic.
Hey, it's Lori Barr here, the doctor's mentor, and I've got Dr. Amanda Myers, emergency physician, with me today, who's going to talk to us a little bit about the strategy she uses to come back to Liberty Hill, Texas, fresh after several weeks of locums ER work all over Texas, and how she rejuvenates herself so that she can turn around and do it again in just a few days. So Amanda, what's your primary strategy for keeping your energy up when you're on working?
I tend to do a close regimen in the morning for supplements. I do a vitamin C, B complex structure. I do a green drink. I do a protein shake in the mornings. I find that if I do that, I can sustain energy differently throughout the entire day. I am careful about hydrating. That's really a key component in what you're doing, especially in the hospital where the environment is so dry. It's a remarkably dehydrating event. So, and then good rest at night. Try to do a little exercise to try to keep the stress levels down. So, kind of a combination of all those things. And
do you find that how many years have you been practicing?
I have been in the emergency department since 2001.
2001, okay,
Mm-hmm.
so 15 years.
Mm-hmm.
How has working in a stressful environment, are you more attuned to your own stress levels or less attuned to your own stress levels?
I think during the stress event, not in tune at all, because you're really very focused on what the chaos is in front of you and trying to organize it in a way that you can then make block steps towards something that's successful in that environment. I think after the fact is when the stress kind of, you feel it. Like I think, experience when you leave the arena or the environment that is creating all of that stress. That's when you kind of go, wow, I'm very tired, or my head hurts, or I just feel drained today after the things that have gone on. So I think while I'm there, I'm just very go, 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 go. And it's after that has ended that I kind of go, wow, that was bad.
So one thing I've noticed, because, as a radiologist covering a bunch of ERs, we kind of feel the same thing. Not the bloody hands, but, we still feel a certain level of stress, feeling like we have to deliver to all the ER physicians that we deliver to. I find sometimes it's really easy to, not even acknowledge the fact that I'm feeling. In the moment. If I get done with one case that's pretty stressful and I need to go on to something else, I won't necessarily take the time to say, oh, wow, I'm really sad, mad, glad, tired, relieved, whatever the emotion is, I'll wait. Do you have that happen too, or do you take the time to acknowledge? It's much more healthy to take the time to acknowledge.
I think that that's true. I think that if you can kind of process in that moment, you'll be more successful in mastering the moment. But I feel like the vast majority of my colleagues and myself included, and I'll specifically address myself, is that the ER is busy. The case that you just walked out of is not your only case. No matter how sad or depressing or unsuccessful that may have been, whether that's a traumatic event or whether that's a medical resuscitation, you leave that room and you don't get to detox much. You don't get to decompress. You don't get to just sit down and say, what did I just deal with and how do I now deal with it in my life? You walk out going, oh, I've got 12 other patients that need answers now too. And so I would agree with you. I don't feel like I address it then at all. I think that in my profession, it is important to discuss with your team that was in the room what happened, and help them maybe move out of that space into the next, but I probably don't do that with myself much at all. I think if your leader is calm and collected, that then the team will be calm and collected. And so it's kind of my responsibility to maintain that space for them. And so when I leave that room, I realistically shift gears just quickly and move into the next phase of what I have to do with the rest of the world that's around me. And I think that that's probably true with most ER doctors.
So when I was asking you earlier about the strategies you use throughout the day to make sure that you're performing at your peak level and able to provide that level of intense leadership and focus, not only for your patient, but for your team, you mentioned that you pay attention very strictly to what goes in your body, not falling prey to the habits that many physicians are trained through medical school, like the gooey donuts and the coffee and the coffee and the coffee and the, oh, let's send out for Starbucks, and oh, it's 2 a.m., let's get coffee. Domino's pizza. All those things, you're very careful about what you put into your body. So let's talk a little bit about what you put into your mind. Do you prepare your mind in the same way before a shift?
You know what? Every morning I do spend part of my morning mind prepping. I think that you can't let anyone speak in your head if you're not charging them rent. So you should probably be very careful about who you let inside of that space. And I think that if you can mentally prepare for or calm maybe your arena before you walk into a space that will be chaos, and it's unique in emergency medicine in many ways, but probably not unique when you look at what we do in medicine every day for any physician, realistically. I think if you self-talk in a way or meditate in a way that allows your mind to be relaxed even when there's stress around you, that will help you deal with anything that's in front of you. And clear thinking is critical in our job. And no matter what part your role is in the care of a patient, if you don't clearly think, something will happen that shouldn't. And so, and we're all responsible for that on a certain level. And that pressure and stress that we build onto ourselves is massive. And I think if you can decompress some of that and just say, I'm going to do the very best that I can, I will pay attention, I will not, ignore these subtle signs or these conversations that people have with me that can piece together this information package, then I can make some decisions about it. You'll have a better day.
Awesome. So it sounds like practices such as traditional prayer, where you start the day with gratitude and where you ask for help for the things that you can't control and you let go of the things that you can't control, so you're not worrying about things that are out of your control, where you ask for help with focus, and also the martial arts, where you're establishing that ability to lengthen the time that you can take the no mind position or the third eye position, where you can come out of the first person role and actually look at what's happening in the room from another perspective, get the global view of what's happening in that place. Those types of practices for mindfulness would be helpful in creating a level of resilience that would serve in the ER setting. Would you agree?
I would absolutely agree.
Okay. And so what about on the awareness level? How, mind, body, and spirit are all good, but if you're not aware, what's the point? So how do you nurture that side of yourself?
I think that in my own personal sort of just life growth, I try to focus on the types of things that will physically allow me to do the things that I want to do, but also mentally prepare me to do those things. But from that sort of spiritual construct side, I think that expansion is valuable. And I read, I do some of the things online that are just programming structures, listening to different types of music or styles of music that will set your mind into a certain, mindset, mind frame. Some of the different just meditation readings that you can do to help you sort of focus on a different not just what is right here in front of you, but kind of a more global picture is valuable and helpful. So I think that those are more of the resources that I go to, and probably because I travel. I don't have any type of a gym that I can attend on a regular basis, or a dojo that I can attend on a regular basis, or a group that I can connect to, because my travel takes me in multiple places, and so I tend to do more online access points than anything else. So
awesome. So when you're in the moment with a patient or in a chaotic situation, does your mind ever wander, and how do you get it back to the place, if it does? It may not. You may be trained to the point that it doesn't anymore.
I don't wander much. I got to be honest. If I'm in if I'm talking in a conversation room with a patient, I think that there are moments when my mind is distracted, and I do try to refocus. And I think for me that focus is, if this were my family, how would I want them managed? And that I would want them listened to, and I would want them heard in a way that is valuable. I would want the full investment of the person in front of them. And so that's kind of my chide on the back of my mind, type the ruler on your wrist type of a thing, to say, give them your space, because they're here because they don't know what to do. And they're asking advice and opinion to understand better what's happening, because they clearly don't understand what's happening. That's why they've arrived. And so participate and do your best, So I know you're an animal person, that you like animals and that you understand animals. And one thing that I learned from a book called, and it's somewhere, it's Lessons from the Horse Whisperer. Mm-hmm. And he talks about listening with your whole being. Yeah. And that that's really the highest form of love you can ever express to somebody, is to give them your full attention with every ounce of who you are. And that takes great practice. And I feel that with you. I can tell that you are here now, as we're speaking. You're not anywhere else. You're not worrying about, what's happening if a cat walks in, or you're not worrying about what's happening behind the camera. You're right here with me. Right.
And I'm wondering, so when you're talking to a patient, how much of you is listening to their words, and how much of you is perceiving like their physiology?
I think for me it's a combination. I think most of our communication is nonverbal. I think we say things that your body will tell you is a lie. The vast majority of my patient base is probably 10 and under. And so their body communication is key. They're not verbal in a lot of ways that matter or can articulate. And, they're 7 before they can actually understand and comprehend, I feel this way right now, I used to feel this way then, this is the difference in the gap between those two places. So I can say, this was here, this is now, and that's the difference. They can't even do that until they're 7. There's not, developmentally, it just doesn't exist. So I watch communication and their physiology and their body to make a lot of my assessment about them. I'm going through an interpreter most of the time as a parent who's observing their behavior and telling me what they think is happening. It's not maybe actually what's happening. So I think you have to be present in that room to be able to understand that, and data collect not from just the word that you're saying, but from the whole sort of complex of what's going on.
And is there anything, I know I deal mainly with pediatric patients too, and I know for me, like when I became a parent, I communicated on a whole new level with kids than I ever had before, because I didn't have that experience in my life before, and so that gave me more insight. Has there been anything in your life that's helped you be a better listener or communicator, a speaker or listener?
I don't know. I think my whole life has been about that. For whatever it's worth, my role, my entire lifetime in my family or in my friend group or in school has been sort of the mediator. And so I learned very young to be that person, to sort of not just listen to the, this is the rhetoric. It was also the behavior that behind that you were having to dissect in order to say, how do we bring these people together to get someplace that we want to go, whatever setting that was, So I think that everything in my life has been building up to that ability, I guess, is the realistic truth. And it served me well in the pediatric population, because they're non-communicators overall, and so you are really watching what the dynamic in the room between them, their parent, their sibling, or between me as well, and how to get them to participate with allowing us to figure out what's happening and what our next step will be. So, I think that, I've read books and I've listened to talks about body language and communication, and we're saying more than we think we're saying just in our posture and so forth. It's all very interesting, when you really get into it. So
one thing that sometimes gets in the way of good communication between a doctor and a patient or a doctor and a team is the power differential. Not necessarily that a doctor's trying to be at an elevated power, but often the patient will put the doctor in that position, or the staff will put the doctor in that position, or both. And all of a sudden you're on a different power level, and communication is more difficult when power is not equal. Do you have any tips for equalizing that power differential?
Interestingly enough, the title of doctor for me is not that valuable. I feel like it is for a lot of people, and they use that and wield that. I introduce myself as doctor when I walk in the room because I want a patient to know that they're seeing a doctor. I don't want them to feel like they've just seen a lot of people and they never really saw what they were supposed to see. So I always introduce myself, but then I come in and classically try to sit down, because I think the differential in who's towering over someone creates a unique dynamic of control in the room. And I try to play with the kid when I see them, or communicate with the parent in a language style that they're communicating with me in. And so if you match and mirror their conversation piece, how fast is their cadence of speech? How, what words do they use? Are they really articulate, or do they speak a little more slang style? So if you can mirror part of their conversation, or even some of their body language, I think that you'll connect in a completely different way with them. I don't tend to use a lot of doctor speak. I try not to use large words because I can't even spell them half the time, let's be honest. So I'm a bad speller, but I think if you can communicate with somebody and have them understand it, then they feel like they have some mastery in what they're being exposed to. And if you can do that, you can walk out and be successful in treating or understanding what's happening and not be scared. And I think for me, that's my ultimate goal. Walk in, put us both on the same sort of space where we can communicate appropriately about what's happening for them, and then come together in a way where they walk out understanding what's happening with a skill set that they can replicate, understanding when it's a problem and when it's not a problem. When do you not worry about it? When do you get more care? Type of a situation. And if I can do that, it's always fantastic.
So the key word that struck me in that was alleviating fear, because fear is really what stops everyone from doing anything.
Absolutely.
I mean, fear is the thing. And in the ER, well, some people say that no matter what your fear is, it's all fear of death when you get right down to it. But in the ER, the fear of death is pretty palpable in a lot of situations. And I'm wondering if you consciously tell them, do you verbalize, okay, here's when to be afraid, here's when not to be afraid, or how do you communicate that?
I think it depends on the parent. I do try to break it down to that level. This is when we're going to be worried.
Okay.
We're not worried about this at all. This is normal illness cycle. These are parameters we expect. We see this is what your body naturally does to help you out. These are not problems. These are the things that you need to do to make yourself more comfortable while they're happening. But they're not your problem. What we know now is that if these things change and become over here, then we need you to be seen again, because we would be concerned at that point that something new is happening, and that something new could need more care in order to help you survive and do well, or not have something else that becomes a problem. So I think commonly break it down onto those terms, because those are terms people get. They don't get the deep medical concept and physiology. They're not going to understand oxygen diffusion ratios and acid-base statuses and how your physiology is shifting. What they get is, I'm sick and I feel bad, and I'm worried that all of this bad is going to be worse, and then I'm not going to be able to recover. Or my kid, who's normally bouncing around this room, is just quiet and cuddly, and that is not normal at all. Like, how bad are they? That's their concern, right? Mm-hmm. So I think you have to bring it to that point where people can say, that was my fear. Really, like, I need to know that what they're doing right now is okay.
So how do you help yourself overcome fear?
Oh, that's a great question. I think fear is a crippler, and I think that you have to look at any situation that you're coming in front of or being confronted by and say, are my behaviors being driven out of just sheer panic and fear, or can I transition them into something that comes out of love? Am I supported in this space by anything that's around me that will help me move forward in this space? And whether that's the people that surround me, the equipment that surrounds me, my knowledge that surrounds me, my own health that surrounds me, whatever that is that creates that dynamic. For me, when I start to just panic, I have to just step back 1 second and say, all right, where am I and what supports me in this? Because if I can get supported, then I become more love and gratitude than I am fear and panic, and everything will swing at that point.
And what I notice in you is there's a solid column of love and support for yourself already established, which is huge in being able to recognize the love that supports you outside of you. Sometimes in medicine, people get used to the power, people get used to the attention, and they forget that if they're not growing in self-love, then it's going to be harder to really recognize the love around them when they need it. So I want to commend you for the fact that you've got a solid anchor of self-love there that helps you recognize what is around you to support you in every minute.
Well, thanks. I don't focus on that as much. I think that, especially if I'm at work, I pay a lot of attention to my staff. And working as a team and how our dynamic works, because I think if we all have a base of connection between us, we'll all function significantly better. And when you're in the emergency department and crazy things happen, I mean, they commonly are life and death. You commonly win, but you commonly don't win. And, not winning means something devastating for someone. It's a loss, or it is a reduction of function and life space for somebody that's going to be challenging. There's no question about it. And if you're not supported by people that you can look at and say, what else can we think of? How else can we do this better? Where else can we go with this, to make this maybe work? If you do that alone, if your title and your power is all you've got, you're going to lose quick and a lot. And so I think that that's, for me, in the way that I approach my job, a key point. My team is valuable. Every day it's a different team, because it's a 24-hour day job, 7 days a week, all year round. So you're constantly working with a new dynamic of a new group, but there's a core there, And I think if you set a milieu up as the leader of that team, then people have that space to participate in, and that makes a huge difference.
So, physician burnout is a serious problem right now, and physician suicide is a huge problem too. If you had one piece of advice to share with someone going into medicine right now, what would you tell them to help them develop the skills they need to successfully practice medicine for at least 15 years and to feel good at the end of the day, even if they've worked hard, even if they've had bad things happen, to still go home and be able to say, I did my best, I treated everybody as if they were my own family, and I love myself?
I think that's a lot of it. I think you have to be clear when you walk into your job what your job is, that you're there for a reason, that people are not just wasting your time with, questions that seem routine. I answer the same handful of questions in every room that I walk into, and by patient 32, it is really easy to be seriously, here we go again. Let's talk about fever one more time, But you have to. For them, it's new. And I constantly think about this. I see people in these rooms that have a question about a topic that they don't know. I don't know a lot about taxes. If I walked into my CPA and went, what am I doing again? Really? I'm sure they would be seriously? One more time, let's talk about. So I think if you put yourself in their shoes, how would you want to be treated? in an area that you weren't an expert, you know, how would you want to be managed in that situation? You've got a valid question you don't know the answer to. You're not trying to waste somebody's time. It may be the dumbest question ever, but really it's important to you to be answered. And I think if you can do that with your patients, that's the best thing you can do, you know. And for me, again, always, I kind of fall back on when I'm losing my compassion factor is, if my grandmother walked into this room and had a problem, how would I want her managed? You know, how would I want my cousin to be treated when they have no medical experience at all?
And if you don't love your family, think about your pet.
Right, exactly. There you go. Find someone you do love and work from that front. Yeah, for me, it's always, I'm the only medical person in my family, so they're all, you know, when we get into a hospital setting, they're just like, what? We don't, like, what? They're just fish out of water, you know what I mean? It's so that's always what I kind of come back to, and so it's important to do that, and I think you have to. It's due diligence. It's know what you need to know so that you can make good decisions, and then you have to be able to walk away from that saying, in that moment, I did everything that I could do to the best of my ability and knowledge. I asked the people that participated with me if there was anything else that we could do that they could think of as well. And if there was nothing else, there was just nothing else. And we're lucky to live where we do. Let's be honest. Our medical infrastructure here is bar none. If you lived in Africa, you just die at home every day with no help at all. And so we're very fortunate to live where we live. We have a lot of resource to be able to steal back life from death, and that's pretty amazing any day of the week when it happens. But when it doesn't, you have to be forgiving enough to yourself to know that everything was done that could be done.
Yeah.
And I think you just have to be able to say, it's sad and we did it all, but we still couldn't manage. And I think that's the suicide rates and the burnouts are hard in medicine because we're all very type A driven people. We don't like to lose. We don't like to be the people who didn't get it done. We like to be the people who walked out going, yes, you know, it happened, you know, type of a thing. And so when we walk out and we don't win, it becomes my fault that happened. Not that they were sick, not that death had them anyway, not that nothing was going to make that different or better, but it was my fault because we didn't make it happen, you know. So I think you have to be able to step back from that into a deeper reality point and say, you know what, really, we tried.
Yeah. So you got a couple days off here before you get back on the wheel again. What are you going to treat yourself to that's really special?
I'm going to see some of my family. I'm going to rest a little bit, sleep a little bit. I think sit outside and enjoy the sun and be around my animals that I love and, just hang out.
Well, thank you so much for sharing a few minutes here with us. It's really special to have you talking about how you nurture yourself, your patients, your team, and your leadership style, which is just so amazing. So thank you very much, Amanda.
Well, thank you, Lori. It's good talking with you.
There's more to explore at thedoctorsmentor.com.
Are you stopping at a hospital? Hello? Don't you know that hospitals are one of the sickest places on the planet? Don't touch anything in there and get out as fast as you can.